So, I think we can all agree that drugs present a significant problem to our society. Between the effects of addiction on families, or on productivity, or especially monetary costs to society, it's fairly obvious that as a country we need to do something about the issues that arise from drug use. Just to give you guys an idea, in 2007 it was estimated that the cost to society of drug use was $193 billion. Another example is that healthcare costs for employees who have addiction problems are twice those for other employees, according to the Pew Charitable Trusts. So currently in the United States we have a system of criminalization in which individuals who use drugs that are illegal are essentially treated like criminals. In many instances they're put into prison. And this system is fundamentally flawed for a number of reasons. First of all, the war on drugs has contributed significantly to overcrowding in prisons. Focusing on punishment rather than treatment results in less people recovering from drug use. And drug rehabilitation efforts in prisons are sparse and ultimately ineffective. On top of that, criminalization is ineffective in discouraging people from using drugs in the first place. So, in terms of overcrowding in prisons, in 1980, 580,000 people were arrested on drug-related charges in the United States. By 2014, that number had increased to about 1.5 million. Nearly half of the 186,000 people serving time in federal prisons in the United States are incarcerated on drug-related charges. So, all these people in prisons, and it turns out that according to the Substance Abuse and Mental Health Services Administration, only about 17.8% of them receive the treatment that they need, and that number has remained largely unchanged throughout the decade. According to another source, Newswise, it's estimated that only 10% of convicted drug users or drug offenders receive rehabilitation that they need. On top of that, criminalization is ineffective in the first place from discouraging people from using drugs. In other words, it doesn't really take a large bite out of the problem to begin with. A quote from what's his name? Glenn Crete. He's a policy expert on drug policy. For all of the money we spend, there's little evidence that our current drug strategy has significantly affected drug use rates or availability. Nearly half of high school seniors have used an illegal drug by the time they graduate. So, a 2008 World Health Organization study of 17 countries found that the United States had the highest rates of illegal drug use, despite our fairly strict punitive policies. So in the face of this, I think it deserves some reconsideration on our part on how we should be treating the issue of drug use in the United States. And we propose that this issue should be treated more as a health issue and less as a criminal issue. And what I mean by that is not that drugs should be legalized, but the people who use illegal drugs should be treated as people who have a health condition and not people who are criminals who need to be sent to prison. So what we find here is that treatment-based alternatives to prison are more successful in rehabilitating patients. Focusing on treatment rather than criminalization saves money. So anyway, treatment-based alternatives to prison are more successful in rehabilitating patients. One program in Maryland is a pretty good representation of what the potential treatment programs are. That's the Maryland's Alcohol and Drug Abuse Administration. So they have a program that diverts drug users from prison and puts them in treatment. And their findings are that those who completed treatment successfully had substantially lower substance abuse than they did at admission. And between 40 and 50% of the program admissions successfully complete their treatment programs. that number may seem low, however, it is much higher than the success rate of imprisoning a drug offender. Another program similar to this is Brooklyn's Drug Treatment Alternative to Prison. Similar, it's a 15 to 24 month residential therapeutic community treatment that is an alternative to prison. It was found that graduates of this program were 3.5 times more likely to be employed than they were before arrest. 92% were working after they completed the program. Moving on to costs. If only 10% of drug-addicted offenders receive drug rehabilitation instead of jail time, the criminal justice system would save $4.8 billion compared to current costs. And if that number increased to 40% receiving treatment instead of jail, those savings would rise to $12.9 billion. So it's hard to ignore the fact that our current system is largely ineffective, and the potential for treatment to be successful at combating the problems of drug use is very high. Thank you.